Well, good afternoon. At least in Montreal, it's afternoon. I know some of you come from other parts of the world, so good afternoon, good morning, good evening, wherever you may be around the McGill world. So I'm Karl Moore. I'm an associate professor at the Des Hotels Faculty of Management. I spent 11 years with IBM and Hitachi before I got my PhD, taught at Oxford for 5 years, and then came about 20 years ago to McGill because of its great reputation and partly to work with one of our guests today, Henry Mintzberg. So I'm working on my 11th book on introverts, ambiverts, and extroverts in the executive suite. So today I'm going to have discussion with Henry and Susan Mintzberg. We'll have a set of questions. We'll have some that are also coming from you, so you can send that by the question box. And a couple of our wonderful McGill alumni people will check on it and send us some of the questions on to me, and we'll ask those later on. As well, we've had some questions sent to us earlier by email, which we'll ask towards the end of the interview. So our two guests today are Henry Mintzberg. He is a McGill grad, the engineer 61. He's a writer and educator, one of the top thinkers in the world about management and also about developing managers. He's the Cleghorn Chair of Management Studies at the Des Hotels Faculty of Management, and he co-founded the International Masters for Practicing Managers and the IMHL, as well as coachingourselves.com. Susan is a PhD candidate in social work at McGill. She has an MSW 11 and is almost on her PhD, she tells us. It's about the role of family givers in psychiatry with a focus on collaboration between family members and mental health care professionals. She's written some op-eds recently. This is very, very timely given the COVID crisis the world's going through. Prior to her PhD, she had 10 years of clinical experience with families and individuals in community mental health. So she's been out there and done it as well. She has taught or co-taught at McGill in the schools of social work and the faculty management on the IMHL. So Henry, I'll just get to our first question then and bring in Susan in a moment or two. Henry, you've studied management, what they actually do during your PhD at MIT back in the 60s. Few people have looked at management as long and as profoundly as you have. These days, we're all working from home, spending our days on Zoom or something like Zoom. Henry, is this going to change how we manage when this crisis eases up?
You know, I did my study back in 1968 when I studied 5 chief executives, and ever since then, people are saying, well, how has management changed? You wrote the book in 1973, and you've done other things since. You know, what's new in management? I always say, you know, in a way, there's nothing new in management. In a fundamental way, management is a practice. It's a basic practice. It's not science. It's not technology. It's not technique. You're not like a surgeon who's learning all kinds of new ways of doing things. Management is a practice that's largely craft based on experience and art based on imagination. And so what happened in my thesis is you know, I went in with the understanding that everybody had, that managers plan, organize, coordinate, and control. And I found they got interrupted a lot and they were action oriented, just didn't jive. So right from then, sort of the practice on the ground of effective managers and the theory were really in disaccord. In a sense, we keep the theory because people think managers plan, organize, coordinate, and control. And yet on the ground, things don't change. Managers have always dealt with crises, sometimes not often worse, often not so bad, but crisis handling is a fundamental part of managing. It's just really, really intense right now, especially if you're in government.
Do you think that we're going to work at home 5 days a week and that the office buildings in downtown Montreal and Toronto will be emptied out? That's one view of where we're going to go. What's your thought on that?
I think there'll be more of that. I think, you know, we're obviously finding that things like Zoom and so on are really, really effective in some ways. I've always been negative about the IT sort of practice of management. I remember a deputy minister in the Canadian government saying he communicates with his staff every morning on email. And I thought to myself, buddy, you better get in the office and meet people. I've always felt that way. Zoom takes you pretty close and saves you a lot of travel. In fact, Zoom, in a way, is more intimate because what we're doing here now, Karl, we're almost face to face. We can see each other. We can see each other's motions and everything. So we're quite intimate in this relationship. Whereas if we're 10 people, let alone 800, but if we're 10 people in a meeting, it's not quite as close. So there are advantages to Zoom, but that kind of creative, open-ended problem solving, which we need much more of, is harder to do on Zoom. And you don't meet people at the coffee machine on Zoom. Everything is scheduled, whether it's Zoom or whatever else it is.
Let me just ask for a minute, where you guys have been in the lockdown, because you have interesting backgrounds there. So Susan, you have a partner and 3 kids. How nuts has it been for you?
What was it? What?
How difficult has it been
Yeah.
with all the people in one house?
You know, I think for me, it's gone fine. We have plenty of space. I have 2 of my kids are a bit older. I also have an 8-year-old who's quite independent, but she regularly reminds me that, you know, I should be paying more attention to her. So that's sort of keeps it all real. But you know, it's okay. I think for us, it's okay. I certainly miss interaction, and I miss kind of, you know, being with people and, you know, hugging people, but all in all, we're doing okay here.
So Henry, very interesting background. Is that a picture, or where are you? Is that where you actually are?
We have a place in the Laurentians. We're on a lake. I was out canoeing early this morning. It's kind of callous to say in a way, but we're not suffering. I mean, nobody thinks we should be suffering. In fact, I've been devoting my effort almost full time until recently to trying to track down an angle on the pandemic that nobody seems to be paying attention to. So I've been working really hard on that. But basically, personally, Dulcie and I are up here. We're comfortable. We're on the lake. No human being other than 2 of us has stepped foot in this house in 2.5 months. We get all our groceries delivered to the door. We take walks on the road where nobody else goes. Even on our lake, which is largely a wilderness lake, we occasionally see somebody else, and we keep our distance, which is usually about 220 meters. We're not suffering because we're extremely lucky.
There's serious, but your point about Zoom is that I would not have seen Susan's library or study before, and I've seen your place up north, but it'd be once in a great while as opposed to every time we connect. So it's essentially getting a sense of the people's personalities as well.
Yeah.
I think, Karl, I also think one of the things that I found really interesting is that you get exposed to worlds that you don't otherwise have access to. So, for example, my 2 older kids are in high school, and they've, in the last month, started some Zoom classes. And I keep sort of having this fun time where I walk past them, because when do you ever get access to your teenagers in high school, right? So my teenager's high school is now in the living room, and that's it's just neat.
So Henry, one of your big ideas is that of emergent strategy, that kind of the Michael Porter School, you do your industry analysis and the work comes down from the CEO down to the rest of us schmucks, and we do it. Where emergent strategy comes more from the frontline troops. During the crisis when it started, just shut everything down was the obvious thing. But as we start coming out of it, what is your advice to think about strategy for organizations as we come out of this crisis and begin to our economy reopen?
Well, let's go back a bit to this idea of emergent strategy. You know, IKEA got into selling unassembled furniture because a worker tried to put a table in his car and it didn't fit, so he took the legs off. And then somebody very clever, because I'm sure workers had done that before, but at this point, somebody very clever said, hey, wait a minute, if we have to take the legs off, so do our customers. And that was the origin of this amazing strategy that changed the whole furniture business. So this top bottom thing is just a lot of silliness. Strategies are grounded, and chief executives or workers or anybody else who are going to come up with strategies are going to be grounded. They're in touch with customers and so on, and they see what's going on. Strategy is a learning process. One of the things that not a planning process. One of the things that bothers me about the whole treatment of the crisis and everything else we seem to do these days is that we're disconnected. We have all these pat solutions to everything. So the pat solution here is distancing and isolating people and hand washing and masks and so on, vaccine. Those are the pat solutions, and they're very, very.
Henry, we lost the sound on you. So Henry, we can't hear you at all. So I'm not sure why that is. Let me go give a question to Susan. We'll come back and see if there's something. So Henry will come back and join us in a moment. So let me just get to a question for you, Susan. So Susan, Henry and yourself did a recent presentation, McGill Senate and Board of Governors, about rethinking the university in the 21st century. Could you tell us what you said about it?
I mean, I think this kind of ties into what he was just saying that got cut off. So I'm going to sort of go back to pick up on what he was saying and then sort of answer that question. So, I mean, I'm certainly not going to pretend to talk about strategy because that's not my field. But when I look at healthcare or mental health, or specifically what's going on in seniors' homes a lot in Canada, but I think also around the world, there's a lot of decisions that are being made from the top, and we're not in touch enough with what's going on the ground. And that's some of what I've been writing about recently, that we really need to be speaking to those frontline workers and those frontline family caregivers, whoever's on the front line, to sort of find out what's going on and make some decisions based on that, rather than sitting at the top and making decisions that are somewhat detached from what's going on the ground. And so when it came to the talk that we did, we were kind of transferring that idea a little bit over to academia. And we ended up, I mean, we've played around with a lot of ideas, but what we came up with in our last presentation was this idea of the kind of ivory tower model of academia versus what we played around with and ended up calling an octopus model. So this idea where, again, kind of this very hierarchical model that I think a lot of academia is certainly based on and still exists, unfortunately. Versus this idea that we're kind of collaborating, we're working together, we're working from the ground, and we were questioning, how can we rethink maybe the ways that some of the ways that academia functions, where there's more collaboration going on, less kind of, I mean, I guess ivory tower would be one way of looking at it, but this idea that, I come from social work, my father comes from management. These are very different worlds in the academic setting. You can just see it. One of the slides we used in our presentation was just basically a photograph of the social work building versus the management building, where the social work building is covered in scaffolding and has been for years, and the management building has like a brand new building. So just this kind of inequality that tends to exist, and how can we rethink that by kind of flattening things out and working more together. And I think that applies to this pandemic and part of what my father was talking about. I suspect when he lost Wi-Fi connection is my guess what's going on right now.
Yeah, sounds like it. So how would you do that on a practical level in the healthcare system here in Quebec or elsewhere? How do you get the voice of the frontline troops? And you were one of them for a number of years. How do you bring that into the system, do you think?
I don't think it's that complicated. I mean, I think we often look for very complex solutions. I think part of it is just get down on the ground and speak to people. Listen to them. I mean, these voices are out there. They're out there all the time. I mean, the last piece I wrote in the Gazette last week or a couple of weeks ago was, I guess sort of a critique or a commentary that, the Army put out, or the military put out this report, and suddenly, like, everyone seemed to wake up and, oh, we didn't know this was happening, or we knew it was happening, but we didn't think we could do anything about it. And suddenly, boom, we're starting to do things. And one of the things that I was commenting on is, this isn't new. There's people on the front lines who have been saying these things for decades, and we're just not listening. So, I don't think it's that complicated. We need to sort of get down on the ground, and we need to listen to the people who are doing the work, pay attention to it, and work with them. It's also, I mean, what's been interesting with some of these opinion pieces is I've had people contact me, which is sort of fun to have people you wouldn't otherwise have contact with, and often readers. And I had an 89-year-old woman contact me who's doing a lot of advocacy. And one of the things that's come out of these conversations is who's sitting at the table when we're making these decisions. And we need to have more of these, I'm calling them frontline, but I mean people on the ground sitting at the table, and not just sitting at the table as a token, right? Sitting at the table really is part of the decision makers. I think there just needs to be more of that.
So one of the questions I phoned you and just said I'd ask you last night, give you time to think about it, is that you have 3 kids, yourself and a partner, that you're raising a family. What's 1 or 2 things that you learned about good parenting from your dad?
So you asked me last night, I had my answer last night, and now I've had 12 hours to think about it. So I should answer this carefully, right? But basically, I think the first thing that came to mind was just about raising kids to think for themselves and be individuals. I think, I can't give credit to that only to my father. That was both my parents, but I was really raised by both of them to just be who I am and not be afraid of being who you are, and not being afraid of, within reason, saying what you have to say, and to not be dissuaded by people who might not agree. I think that's probably the most important thing I was taught. And then the other thing, as I guess a lot of people watching know my father and his reputation, as an academic, but I was also very much taught that, family first. So, as successful as he's been, his family has always been front and center for him, and that's the same for me. As I move forward in my career, and I'll see where things go, but my kids keep me grounded. My family is what keeps it real for me, and that came from my parents.
How about as an academic, one of the world's great academics? I can say that since he's not here. What did you learn from him as an academic?
It's interesting because my father and I have, before I got into academia, before I did my PhD, we really didn't talk shop much. Like he was really just my father. And I didn't know his work. I mean, I hadn't read his books, but who he is as an academic is who he is as a person. So, a lot of what I learned about being an academic came from what I learned from him as a human being. Now that I'm in academia, we've sort of talked a lot more about academia, and how I'm kind of making my way in that. But I think the message is sort of similar. I think what I learned from him, probably more from osmosis than anything else, is again, just to not be afraid to do your thing. I think especially when you're going through a doctoral program, there's often this sort of feeling that you need to somehow fit in, or you need to do the right thing. And to a certain extent, that's true. I mean, you gotta get your battle scars if you want. But I think it's really important that we not be afraid to, have our own thoughts and run with it. And I think that very much came from just watching him, basically. He never sat me down and said, okay, we're going to have the talk. Here's what you need to do. But, I see how he lives his career, and that just kind of got infused in me as I was growing up, and more so in the last few years, I guess.
So certainly the willingness, even in his PhD at MIT, to challenge conventional thinking and look at the data and say what's actually happening out there. So it's part of what I think you're getting at. Susan, you've been writing a fair bit recently about the role, and this is what your PhD looks at to a certain degree, the role of the family in healthcare system. And in Montreal, around the world, a lot of times families have been not allowed to be involved. What's your thoughts on that subject?
I have lots of thoughts on that subject.
Oh. All right. I think I'm back.
I still get to answer my question. We don't see you though. I know. I'll answer the question while we.
So go ahead, Susan. We'll bring Henry in.
Yeah.
What do I click on?
Okay, so I'll try and answer with his trying to figure out the technology. As I come to the end of my doctorate, this is really what I'm looking at. It's the role of families in mental health care. But it's been very interesting to sort of make a parallel with what's been going on during the pandemic in seniors' homes. I mean, obviously, I'm looking at it in Canada, but from what I understand, it's really happening around the world. And my main message is similar to what I was saying before. So before I was talking about frontline workers, and we need to be, talking to them and connected to them. But what I'm suggesting in my work, and what I've been suggesting in the last few months of writing, is that families aren't just visitors in this system. So whether it's mental health care, whether it's seniors home, long-term care home, or families aren't just visitors; they're really part of the system. So I've been referring to them as the invisible frontline workers behind the scenes. And this idea that when the real problems hit, that we just sort of say, okay, we need to remove families as visitors. To me, in Canada anyhow, we really saw the system start to sink. Because they really have a huge role in helping to maintain the healthcare system, and it's not recognized. So partly I think it needs to be recognized, but partly I think we need to be working with it, because I don't think it's that we need to recognize it as a problem. We need to recognize it as a strength. and we need to just be bringing family caregivers into this circle. And when I mentioned earlier this idea of who's sitting at the decision-making table, you know, certainly in psychiatry or in mental health care, I think family members need to be at that table, because they have a huge piece, they offer a huge piece of the puzzle that I think we're missing out on. So that's what I've been writing about.
So Henry, you started the IMHL, the International Masters of Health Leadership at McGill 14 years ago. You're thinking a lot about healthcare right now. Susan just shared her view of the importance of family. What are some of your thoughts on the healthcare system, and what have we learned in the last few months about how it might be improved?
Well, there's going to be, you know, I'm sorry for that. I don't know what happened. I had trouble getting back on, but anyway, thankfully I'm back on. You know, I start off by saying that even strategy and management really happen on the ground, and so the answer to the question, Karl, is there are going to be so many things that people are going to be learning, that all kinds of little grounded things, you know, whether how you're in touch with your employees, how you care for them when they're suffering these things. And some people are doing it wonderfully well, and some people are not doing it wonderfully well. And so the learning is going to be vast. Obviously, there's the IT learning, and people are going to be working from home a lot more than they have. As far as the healthcare system is concerned, maybe we'll learn that it's not all about the top. You know, country after country, they're so, when I did my book, Managing the Myths of Healthcare, I could see this in many different countries where people are managing from a center and they're so disconnected from reality. And we've had our share of that. Certainly the US is off the scale, and the UK and Brazil, those three countries are off the scale in terms of people making decisions in complete, worse than ignorance, almost malevolence. I'm not sure it's malevolence, but it's certainly ignorance. Lisa, my other daughter, was emailing this morning about how Britain, despite all the cases, they've opened everything up and people are forgetting about distancing. And so we got to wake up in terms of how we're managing healthcare, and we've always been mismanaging it from the center. Always this idea that if you sit at the center, somehow you know better. Whether it's a chief executive of a hospital or the head of a province or a state or wherever it is, you know, famous case in Quebec where we have one of the world's best authorities for dealing with this, Joanne Liu, who ran a graduate of our IMHL program, who ran Doctors Without Borders for 8 years internationally and just came home. If you want to find a manager who's trained in dealing with crisis in healthcare, God, Joanne has got to be head and shoulders. She was a major player in the Ebola crisis and convincing the WHO to wake up to this crisis. They didn't use her. They didn't even, the only time they ever kind of started using her is when they were humiliated by reports in the press that they weren't using her. So this idea that somehow you're chief executive and you know better, whether it's a hospital or a whole healthcare system or an insurance company or whatever it is anathema to proper management, which is grounded. You get in touch with the people who know what's going on.
Susan, what's your take from inside the system that you've worked for years, now you're studying it? What do you think of Henry's view?
I mean, I think we have similar views of it. It's sort of what I was saying earlier. I mean, I think that I mean, again, it's his example of Joanne is sort of is to me a parallel of what I was saying earlier, right? Like, how are we making decisions about who we're consulting, who we're bringing in, who are we talking to? Like, how are these decisions being made? And, you know, my sense in the system is that they're being made often, and it's certainly not to criticize the whole system, because I think there's a lot of good happening in there. But, you know, I think a lot of these decisions are being made in offices with a group of, I don't know, whatever we want to call them, executives or managers or whatever. You know, they're sitting down, they're looking at their papers, they're looking at their graphs, they're looking at their statistics and making decisions based on that. And I think it's very detached. So I look at it much more on a kind of clinical ground, hands-on level. I think my father looks at it more as a managerial, like if you look at this example that he just gave is sort of more, who do we bring in to manage? I'm saying, let's go beyond that. Who do we bring in to talk to in the first place? Even, let's go beyond the managers. Let's go right down to the people who are doing it on the ground.
Yeah, Karl, if I can add something, I made a note before about the difference between established experts and playful explorers. And this applies whether it's to management or research. I'm particularly concerned about research. That we defer to established experts who know better. And there are two kinds of professionals, okay? There are professionals who really know better, okay? Like when a surgeon is cutting me, I don't say cut higher, please, okay? But a social worker or a psychologist or a manager, when they know better, it gets in their way because they've got to hear better. They've got to be in touch. They've got to hear what people are doing. And same thing, I have a thing with epidemiologists now because what I'm trying to convey has been blocked by epidemiologists who won't see past a set of techniques and approaches that are working and are good but are insufficient, and go try, what I've been proposing has been treated like Trump's bleach. It's kind of like another crackpot idea. Well, I'm not a crackpot and I'm not Trump, but I couldn't get through. I just posted on my own mintzberg.org, and that's it. So, we need much more playful. Too much, everything is pat, everything is fixed. We need to be much more playful. We need to explore much. And in this whole coronavirus research approach, it's not just about, 2 or 3 years of research to get a vaccine, which of course is very important. It's about being playful with ideas that come along. Maybe there is a form of transmission in the air. There's lots of evidence for it, but go try. And it could make a huge difference if it's true, but nobody wants to explore it. It's kind of like, oh, we don't want another crackpot idea.
Can I add to that? I think it's also, one of the things my dad and I have been talking about, I've been thinking about and sort of talking to him about, is this whole idea that the world currently is upside down. The people that, we often don't hear or don't have much input are now kind of front and center and kind of bringing us towards safety. And I just, I think we need a lot more interdisciplinary collaboration going on. I think too many big decisions are made by certain kind of people or certain disciplines. And so when I think of, the field I'm coming from, social work is very much about this idea of speaking. We're looking at the system, like we're looking at the bigger picture. We're talking to people. It's very much about looking at, all the different parts and how they're working together. That's, to me, what drew me to social work. What I love about social work is this whole kind of systemic look at things. And I just don't think we're doing enough of that. And so if we had, for example, obviously I'm a bit biased, but if we had more social workers, interacting with more people from business or more people from medicine or even engineering or like whatever, like if we could sort of bring more interdisciplinary people together, I think we would have, a much more diverse way of looking at the world, and it could impact how we make decisions.
We're going to take some questions from the audience in just a minute, but one last question for you, Henry. One of your big books was Managers, Not MBAs. And through the IMPM, IMHL, the ALP, you've done a bunch of programs where you actually did something about it. But where's your thinking about how management education should be improved from here on out? What's your latest thinking, Henry?
Well, first of all, we've undergone steady improvement, nonstop. 23 years ago, we created the IMPM for business people, and about 10 years ago, the IMHL for healthcare people, and we're constantly innovating. And now Leslie Breitner, who runs the IMHL, has just designed an entire module for, we have 48 people, believe it or not, in our healthcare program. It's a hugely popular program, mid-career people, and they average about 45 years old. And Leslie and others with her have designed a whole module, online, 100% module online, and not just, lecturing, and doing the usual things. She's got groups and workshops, and the things she's doing are absolutely stunning, doing all this. And it's going to impact We want our class to get together. You put 50 people in a room, you got a chemistry that you can't believe, especially when so many of them are there. They're not there just for their careers, they're there for healthcare. That's the amazing thing about a healthcare program. When I ask who's here for healthcare worldwide, almost everybody says that's the main reason I'm here. And so tremendous amount of, and all the innovation that we did in the classroom is now being converted to how you do this online, how you get chats going. Now, very sophisticated chats where we have what we call rolling in and rolling out. We'll have an in-group, an inner group discussing, let's say there's a few physicians in the class who are particularly adept at something or other. They'll have a conversation and the rest of the class will sit around. And then other people can tap them and replace them. So people are joining the conversation, but there's never more than the fixed number of chairs. She's doing that now online. I mean, terrific stuff, absolutely terrific. McGill is wonderful. And also how supportive it is for all this.
Susan told us a little bit about the presentation you two did to the Board of Governors, the Senate at McGill. Do you think this crisis will give more impetus to rethinking and reinventing the university, making it more of the one that's involved in the community, as Susan told us, and not the ivory tower? Do you think this is going to help, Henry?
Yeah, I'll let Susie take that one because she's, and I can come back to it too, but kind of what we did.
Maybe you could add your 2 cents for us, Susan.
Yeah, I mean, I when you were kind of offline, I talked about what the presentation was about. Will this change it? I mean, I think things are changing already. Like, I mean, suddenly McGill is, entirely online, whereas, I always sort of think if 4 months ago someone had said to the people in charge, within a month everything's going to be up online, we'd be laughing, and suddenly here we've done it. So it shows that things can be, if you knock out all this bureaucracy that you don't have time for, things can be done quickly. So I think things are already changing in that sense, and I think maybe what we'll get out of this pandemic more than anything else is the realization that change doesn't have to be that complicated. We don't need that many kind of layers to make these decisions. So in that sense, yes. But on the other hand, this is a big machine that's been going for a long time. And, I remember because a lot of my work is looking at change in mental health care. And someone said to me, change takes 17 years, which was a bit discouraging. But so, yeah, I think things will change. Will this change it dramatically? My hunch is going from an ivory tower to an octopus model, I think, is going to take more than a pandemic. And it's going to take people willing to make the change, right? I mean, we're going to, eventually we'll come out of this pandemic. We'll all be changed somewhat. The world will be different. But I think, the majority of people will comfortably go back to what they were used to. So I think we need to keep fighting, or not fighting, but pushing to get change to happen. Okay. I can make just a quick parallel that, I was speaking to someone who lost a father during the pandemic in a senior's home. And one of the comments he made to me that really stuck with me was, we're seeing, people are kind of up there and getting out there and pushing for change. But he said, we all need to take a role in ensuring this continues once this pandemic's over. And I think the same thing would apply to that question. It's not going to happen unless we commit to, in the long run, making it happen.
Yeah, sorry, Carl, I didn't know you had already talked about the octopus and the ivory tower.
Let me get to a couple of questions from the audience here. One is Adam Hoffman, and it's to Susan, but I think Henry as well. I'm a frontline healthcare worker, physician. I've been trying to communicate common sense to the behemoth of government for years. No one listens. Do you have advice on how to translate listening to action? So what would you two say to Dr. Hoffman?
I would say to him that the number of people who tell me the same thing within organizations is huge. I remember when Susie was working in a bookstore, and the managers would come by and look over her shoulder and then ask her boss, and she said, "Why don't they ask me? I can answer the question." This happens everywhere. It's this cult of management that somehow managers are separate, or leaders. This is the big word, right? Leaders are separate from and better than managers, and therefore they don't need to listen. It's horrible. It's absolutely horrible, and it's like a disease. It's our own form of pandemic, if you like, that this disconnect, that lofty leadership is better than grounded management. And whether it's a physician who says, you know, we had a minister in Quebec, the previous minister of health, oh God almighty, but I mean, just wiped out all the management, wiped out everything, just made all these arbitrary changes and just wreaked havoc in the system without connection. But within organizations, I get it sometimes a few times a week. I can't stand my boss. I can't stand to work here. They don't listen to me. You know, management is so basic. It's not simple, but it's so fundamental. You know, let me tell you two quick stories. A friend of mine asked the minister, sort of like a deputy minister of health in England, why you measure so much. And he said, well, what else are we supposed to do when we don't know what's going on? Well, the answer to that is find out what's going on. But another deputy minister who was in charge of auxiliary services, like for the handicapped and all that, he said, such a difference. He said, every Friday I'm in the field. I meet the clients without the professionals, then I meet the professionals without the managers, then I meet the managers. Okay, that's how he finds out what's going on. It's not hard to find out what's going on. That's not micromanaging. That's just being in touch. It's knowing what's going on. And there's so much disconnected, lofty leadership. I make a pitch for my bedtime stories for managers, because that's my book that uses that as a subtitle. Enough lofty leadership, you know, time for grounded engagement, or whatever I used. So we really need to wake up to that. Will we wake up to that? I don't know. It's the fellow asked the question has to squawk and scream and say, look, we're not taking this anymore. Doesn't mean that the surgeons have to be in charge. It means they have to work with the managers and with the people in government, and they have to understand, live each other's lives.
So
I have a
Henry's right.
slight
Practical advice, Susan.
My advice is use stories. Stories change the world. I think often, like, we can yell and scream and try and, change how the managers see us and all that. But I find that if answering this doctor's question, if there are stories from the ground, that he's experienced, that he's seen, that his patients have seen, whatever, if you can tell a story, people listen to stories. That's been my experience. Maybe that's sort of a social work perspective, like, make it real. And, people might not want to listen to you complain or, say, listen, no one's listening to common sense. But if you tell a story that depicts common sense, people might wake up and listen a bit more. That's my experience anyhow.
So here's another question that was emailed to us recently by Sergey Brokanev. And I apologize, Sergey, for mispronouncing your name. Could this pandemic be nature's nudge towards the plural society, which should cause less self-inflicted damage by default? Henry, you've written a lot about the plural society. It's one thing you've been thinking about a lot. What do you think? How would you answer Sergey's question?
Yes, Sergey is referring to my book, Rebalancing Society, in which I argue that a stool has to sit on three legs. It can't sit on one leg, communism, capitalism, populism. It can't sit on two legs, back and forth between left and right. It's got to sit on three legs. And the third leg, the public sector, the private sector, and what I call the plural sector. Everything that's not government and business, including McGill, including Greenpeace, including social movements and Black Lives Matter and all kinds of things in society. And my answer to that question is a very smart Dane once said, I never predict, especially the future. And my concern about prediction is that pessimists predict what they don't like and optimists predict what they do like. And so they're not really objective. So you can't trust any of them. So I would rather say what I hope. And of course, then the question becomes rhetorical. Of course, I hope that we'll recognize the plural sector. I hope we'll come back into balance. We went out of balance years ago after the fall of the Berlin Wall, when we assumed that capitalism had defeated communism. And that wasn't the case at all. Balance defeated imbalance. The communist countries were completely out of balance on the side of their public sectors, and we were balanced. Even the United States had very high tax rates in the 70s. Johnson had great welfare, huge welfare programs. The US has because of the assumption that capitalism triumphed. It's been triumphing ever since. And the US is totally out of whack on the side of the private sector, as is the UK. And it's not coincidental that those two countries, of all the so-called development countries, are dealing with the pandemic worst of all. These are the two liberal democracies that are neither liberal the way they used to, nor democratic the way they used to be, and they're failing left and right, and it's all part of that same syndrome.
Another question here is, seems that there's new two solitudes sitting in. And again, in Quebec, the two solitudes is a term we know, but this is more globally. People like us with the privilege of home offices, remote homes, food delivery, unlimited entertainment, etc., and millions of others out there doing the physical work that cannot be done remotely. Isn't that the two solitudes going to have a huge impact on management, career advancement, etc.? That's from David Vick.
You want to comment, Susie?
I definitely, people are going to come out of this pandemic with extremely different experiences based on their privilege, based on, what they have access to. So there's very different stories that are being written through this. And, ultimately, the ones who have the like all of us who are able to sit at home and do work and write ideas is very different than people who are having to go out there again, on the front lines. I'm thinking of people in seniors' homes particularly. And I think it's interesting because in Quebec, suddenly something's come out where we've just hired 10,000 people to train as orderlies that are going to be paid for their 3 months of training. They're going to be paid, a pretty good salary, brought in urgently. And it's, these are people who have been doing this kind of work for years, who are not recognized, badly paid, bad conditions. They have no voice, or they have a voice, but no one's listening to it. And I think that the pandemic is really kind of shining on a light on, how come we have people who are kind of keeping us going, the ones who are in there who are doing the work that a lot of other people don't want to do. And I include social workers often in that category, but, I think of orderlies, you think of PABs, and, we need to be recognizing that this is as valuable as the ones sitting at the top making, huge salaries to make the decisions. It's the ones on the bottom who are kind of keeping people alive and adding humanity to our world. And we're not recognizing it, and we're not validating, and we're not giving them the conditions they need. So I really think there is a huge divide coming out. It's being highlighted. I think this pandemic is really highlighting this divide, and hopefully, what we're doing now to kind of increase these salaries, is this just going to be a little temporary thing, and when the pandemic's over, we can forget these people and put them back into conditions where, they have trouble making ends meet, even though they're saving lives in a different way. I hope that.
Listening to Susie answer, it occurs to me, I never thought about this before. I get asked this question maybe more than any other. You know what? It's a question that's being asked of a very restricted number of people, because as Susie says, people who are working in senior homes, nobody's asking them whether they're going to work at home on a screen. And so the question is being asked of a very restricted number of people, including managers and including academics and so on. Sure, we can work at home on a screen, but there are masses of people out there who that's just this question in a way, but it never occurred to me before. But I was going to say, in Finland, school teachers get paid very well, and Finland is a great country for proceeding. In Denmark, if you work for McDonald's, you're earning $25 an hour, so you can live a decent life. And the Big Mac, I did a calculation. I think it costs $1 more in Helsinki, in Copenhagen than in New York. So they it's not a big price to pay for democracy. But coming back to the question as you asked it, and as I, as an academic or managers, live it, I did an interview with Ian Austin, who's the New York Times guy in Ottawa, and he did a sort of an interview for the Canadian readers of the New York Times, and he asked me two different questions. He asked about, well, if you stay home, you're kind of out of the politics. You're out of, how do you get promoted and so on? How do you get accounted for if you're working at home? And then another question was, what about the poor people in the factory? He didn't say poor people, but what about the people in the factory who don't have the privilege? I don't know how he put it, but don't have the privilege of working at home. And I said, well, those two questions actually contradict each other, because on one hand, there's a benefit to be able to work at home, and on the other hand, there's a disadvantage. But look, with everything new, we overdo everything new. So Zoom is going to become the big thing, and Zoom is great. As I said, when I'm having a conversation with someone like now, Karl and Susie, I see you really close. If somebody's asking a question, sometimes they're on the screen and we're face to face, we're 1 foot apart. If we were doing it in a hall where I was lecturing, we'd be 10, 20, 50, 100 feet apart. And you can see, my eye is a bit closed, and you can see everything very closely. So it's much more intimate, Zoom. But for brainstorming, it's not good for brainstorming. It's not good. I think I may have mentioned this before, maybe I didn't, but you don't meet someone at the coffee machine on Zoom because everything's scheduled. So we have to be careful how we use these technologies.
All right, one more question here. This is from Cheryl Rudner Marisan. What steps can we take so that we don't repeat our mistake in abandoning our elderly when the second wave hits? One of the great embarrassments here in Quebec and Canada is that our most vulnerable citizens have been the hardest hit. As a society, we are profoundly ashamed of this. What do we do, Susan and Henry, so this doesn't happen if there's a second wave?
I mean, I think the first thing, and I think in Quebec at least we've figured this out, or so it seems, is that we need to allow designated family members to be in there because they're part of the system. So that's now happening in Quebec. I'm not sure it's happening as much in Ontario. I'm not sure about the rest of Canada. I don't know about the rest of the world. But to me, I think that's a huge piece where we really messed up when we got these family caregivers out. So I think if a second wave hits, absolutely, we need to make sure that those again, it's not to have all families going in and having the grandson come in to hug grandma. It's about having those designated family caregivers who really play a role in helping that person stay well, to be in there. Because I think it's also what do I mean by have a family caregiver in there? It's really the families are the system can't offer that kind of personalized care. We're just not set up to do it, and the families do. So whether it's keeping an eye on things, kind of staying on track, whether it's knowing what the person likes to eat, whether they're not eating, when I sing to my mother or my grandmother, will that help her eat or relax? It's all those little things that the system can't, we're not equipped to do it. So I think it's absolutely essential that those people are if a second wave hits, that they're in there. But I also think, I'm not sure we can solve this in a second wave unless it takes a couple of years. But it's really to be investing a lot more in seniors, and to, it's not just investing, it's not just financially investing, it's actually caring. We live in a society, I think, in a lot of societies around the world, at least industrialized, like, the societies that we're living in, where it's this idea that as people get older, we kind of push them to the side. So it's marginalized populations generally, that when we just don't want to deal with it. So we sort of don't invest in it. We push it to the side, and I don't think that's acceptable. So my work's looking much more at mental health care, and there's huge issues. I mean, I could go on and on about that, but if we're looking specifically at seniors, I think we just need to be caring about our seniors more and putting our money where our mouth is, right?
There was an item on the CBC News last night about Ontario and how they haven't been prior to this, haven't been investigating. There have been all kinds of violations that have been ignored, and so on and so forth. It's all part of a syndrome that is destroying us, and that syndrome is imbalance. And the imbalance is that because people don't want to pay taxes, or corporations don't think they're obligated to pay any significant taxes, or they can take their places offshore in some kind of phony headquarters. They're starving governments. And what do governments do when they starve? They either raise regressive taxes, like sales taxes, or they cut back on services. Guess what? We're not investing in senior homes. No kidding. No kidding. We've been depreciating government and we've been depreciating balance for so long. Of course, we haven't been investing in any of these things because the only thing that matters is the damn bottom line. That's the only thing that matters. And the bottom line doesn't bring us, the companies that are most obsessed with so-called shareholder value, like nobody exists except the shareholder, the companies that are most obsessed with that are the worst companies in general. The entrepreneurial companies are much better. The ones that have gone public, now some entrepreneurial companies go public, but often the family will retain control. But the ones that are beholden to stock analysts are often among the worst, because no matter how much you get, it's got to be more. Apple passes $1 trillion in shareholder value. That's the starting point for the stock market. That's the starting point. Okay, Apple, what are you doing now? And if they don't do anything quite like they did now because Jobs is gone, then they start playing other games, or they get involved in politics, or they lobby, or particularly in the United States, where the Supreme Court legalized bribery. It basically let anybody donate how they like to political campaigns. No wonder the US is collapsing. No wonder the country is collapsing. Thank the Supreme Court and thank the greed that has been allowed to pervade and dominate so many well-being good folks in America.
All right, let me ask one last question. Henry, you're over 70 now. You don't seem to understand retirement, and you're in excellent health. So why don't you retire? And so what keeps you going? And secondly, give us a couple of things about how do you maintain vitality and health, a couple of things that you've learned from life that you can share with us.
You know, Dulcie uses the word relax sometimes, and I never heard that. I don't know what that word is. And retirement, I don't know what that is. It's something about a machine that you're putting aside because it's been used enough. I'm not sure what you mean by retirement, but to be a little bit serious, I just love what I do. You know, why should I retire? I love what I do. I'm deeply involved with it. I have all the time in the world to do other things. We don't have kids at home. You know, happily, we're financially okay. I've been half-time at McGill for like 25 years, but I work full-time on my writing and research. I'm half-time in some respects, but full-time in other respects. To me, it's joy. It's just sheer joy. I love what I'm doing. And so, you know, I mean, I love to canoe too, and we did that in the morning, but I can do both. So, so why retire, you know? And you know, the interesting thing about academics, you know, Peter Drucker was writing books in his 90s. For some reason, academics often live quite long. Mario Bungay, one of McGill's most famous professors, you know, reached 100, philosopher, was writing books in his 90s. For some reason, we age, usually, we don't age badly. Of course, you know, we don't play football, so we don't get concussions, or hockey, so we don't get concussions. And we beat each other up at faculty meetings, but we don't get concussions, so.
I think one of the, well, you asked me earlier about kind of what I learned from my father. So one of the things that he taught us early on is if you do a job that you love, you won't work a day in your life.
Well, Henry, I got to say, on behalf of the audience, don't retire. We hope there's many more years of writing books because we appreciate your wisdom. We also appreciated that Susan, the acorn did not fall far from the tree. I think what we concluded today, that what you got from your father, whether it's through genes and at the family table, we really appreciate that as well. That you brought a lot to us today and appreciate your time. I want to mention one thing. I'm doing some work with McKinsey on fathers who stay home for more than 2 months with newborns. So if you are one of those dads or you have been, send me an email at carl.moore@mcgill.ca. Love to hear from you. So thanks very much for your time. And this will be on McGill YouTube channel if you'd like to watch it again or share it with your friends. So thanks, Mintzbergs. See you later. Bye-bye now.
Bye.
Bye. Thank you for having us and giving us this wonderful opportunity. McGill is great.
It is indeed a great university.